already either on Zoom or on some kind of other web platform. So I totally recognize that the zoomed out is a real phrase. So thank you for being willing to kind of participate with us today. I did enter something in the chat room, just kind of a question, and it's really more to get folks oriented with the chat box. When we get started on this webinar, feel free to answer your questions during chat. If we have an opportunity to answer them during the webinar, we will, but at the end, we hope to leave a little bit of time, so we should be able to answer everybody's questions at the end as well. I'd like to introduce Richard Knecht, who is always so gracious when I call and ask for help. So Richard is supporting us today specifically to kind of talk about 2083 and the background and how it supports planning with Families First. I'd also want to just take a second to introduce Val Ryan, who is our Learning and Experience and Design Manager with the Academy, and she's helping running tech today. All of our slides, so let's see if I can advance these. Yep, good. All of our slides and then everything that we reference here is available on our website on the CWDS page. And we have a special project page, and we have a whole page dedicated to Families First. So you can have copies of this slide deck. We'll actually give you the link to that as well at the end, and we'll email that link out to everybody so everybody has a copy of that. So the purpose of the webinar today is to kind of review the intent and provisions of AB 2083, to review the components of the Chapin Hall Readiness Assessment for FFPSA, and to take a little minute to kind of crosswalk both 2083 and this readiness assessment to sort of see how this work really aligns. And then at the end, we'll have some time to kind of talk about and discuss implications and then sort of needs for technical assistance. And like I said, my hope is to leave a little bit of time for counties to be able to chat with each other. So Val, if we have a poll. So as Val's bringing up this poll, I'd like to, again, introduce Richard Knecht. Richard is, I think he's with DSS, but he is also serving in a capacity with CDSS to support CDS's response to COVID-19. So welcome, Richard.
Thanks, Amy. Great to be with you and our participants today to talk about the interconnectivity between the Assembly Bill 2083 system of care work and the FFPSA work. I'm going to try to assume control here. There we go. Fantastic. All right. And just want to celebrate Amy getting us together. It is not necessarily intuitive for everybody to make the connection between system of care and implementation of FFPSA, but it absolutely does go together. So kudos to Amy and all of you folks for leading out on this. I'm going to try to summarize really briefly, just give you some background on system of care and this 2083 work. And if there's a way to summarize what I'm going to talk about in the next 17, 18 minutes or so, it is that the Assembly Bill really does provide us a unique opportunity to connect our systems in ways that will remedy a long history of disconnection, if you will, between systems that has plagued us and has really hampered our outcomes, not just in child welfare, but in other systems. Doing effective 2083 work or system of care implementation gives us not only an exceptional return on that investment for youth and families, but for systems, both in terms of cost savings and in terms of increased job satisfaction. There's a fair amount of research that suggests that when we're in more connected relationships and deeper integrative service delivery systems, we have less burnout, less secondary trauma. It's good for both service participants and for professionals. Finally, the last takeaway is the system of care really does give you a fantastic context into which We can do design work, not just for family first prevention services, but for almost anything that local jurisdictions do in common. The drivers for this obviously are that youth which require welfare or probation interventions often do so only because other systems have not been effective at serving them. We know that a large number of our foster care youth in this country enter the system only because prior systems have been either ineffective or unavailable to them. Once kids do get into foster care systems, either welfare or probation, and we start that teaming process that's so universal now, it's nearly always evident, probably 90% of the time, that in that needs identification, they express a desire and need for someone else's services. That is a component or an intervention that's not the responsibility of the welfare or probation authority. And so to do good prevention work and to do good early interventive child welfare work, we have to be connected. The third real kind of ideological driver, if you will, to FFPSA being anchored in a cross-agency approach is that we know, of course, universally that welfare and probation systems are often historical pipelines to really expensive and traumatizing services for foster youth when we're not effective. The reason that integration matters, and we'll talk about this off and on in the next few minutes, and then again towards the end of our conversation together, is that we know that treating the entire human experience has to be as comprehensive as possible. We've been disintegrated in our work with kids and families for many, many decades, and it's one of the principal reasons for which we've been often ineffective. And if our systems or the departments that comprise our systems continue in that disintegrated, siloed approach, we should expect to get the same kind of outcomes we have always had. Integrated systems are whole systems. We cannot deliver a wholeness or a healing for kids and families in the welfare system unless our delivery vehicles are whole and integrated. It's a parallel process, and it really does invite us to change the way we do our work. And so AB2083 really does kind of tee us up for that. Let me give you a quick look here. We won't spend a lot of time on this, but the drivers to Assembly Bill 2083 in California go back many decades. Some of you may know that there were 2 prior attempts to build in California a system of care in the mid-'80s and the late 1990s. And what was ironically different and what ultimately led to their fundamental ineffectiveness is that while they were intended to be systems, they were assigned in terms of their design implementation to the behavioral health authorities around the state. And so it was this kind of mistaken a framework, if you will, that we're going to build an integrated system, but let's let the mental health people lead out on it. Well, by its very nature, it's flawed if you assign one party in a system to hold responsibility for everybody else in that system. So what's different about 2083 is it's now held by the Health and Human Services in Sacramento and all of the departments that comprise it. So it's held one level up within the architecture in California, and the Department of Education is a fundamental partner therein. So we have a level of connectivity administratively and operationally in Sacramento that we've never had before, which is super exciting. The rest of these historical initiatives I just highlight here to show that this really is the culmination of a 40-year journey that began way back then. Wraparound has been fantastically successful. You know, we have half the number of kids in delinquency and dependency today than we did back in 1997, largely because of wraparound. And the continuum of care reform is built on wraparound's principles, which we'll highlight here in just a moment. And again, there are other efforts to reform the system, even going back to our child welfare redesign back in 2003. All of these things have brought us to this place where we are now ready, we think, in California to do an authentic, full, large S, I call it, system of care. The blueprint, if you will, is anchored in Assembly Bill 2083, and it's now in code, and it requires a county to develop and implement a system of care memorandum of understanding. Now, that's just a document. It's just words on paper, and I think we all know that those documents, for better or for worse, can have greater or lesser meaning to local systems. But the intent is to anchor it in a document such that it does survive and thrive the various changes that come to local systems. We'll talk a little bit more about the MOU in a moment, but there's a method to the madness of requiring local systems, the county partners and the developmental regional authorities to be in partnership together. I would refer you here quickly to the statewide Health and Human Services Agency webpage, which you can see linked there. And when you get this PowerPoint or this document afterwards, you'll be able to hyperlink in there. And you'll see some of the tools that are available to local systems when they go about or start the journey towards being connected administratively and operationally. Some have asked, well, why system of care? Why do you keep calling it that? Especially when we had attempts in 85 and 98 and they failed. Well, a system of care is a well-researched and established formulary. And there is a broad and well-recognized definition for system of care that comes from the Substance Abuse Mental Health Services Administration. So we've got that in quotes here. My kind of shorter abbreviated definition of system of care is that it's multiple organizations that are ideologically and practically sharing resources, responsibility, and outcomes. It's really all it is. It's wholeness of systems and connectivity of systems. And so we should not get too lost in the long wordiness of a federal definition. It's just about playing in the sandbox together, sharing our toys and sharing our tools. System of care like wraparound and like continuum of care reform and like in many ways like the Families First Prevention Services Act is rooted in very similar principles. And so you see quickly these 10 core principles here, and these are very familiar to most of us, I think, having now been in a wraparound environment for more than 2 decades in California. You'll see all these reflected, not just in system of care, but in FFPSA as well. So we highlight them here briefly for you so you recognize that the building blocks of the approaches are already aligned. It's important to help local communities and local jurisdictions, interagency teams, if you will, recognize that system integration can be done in a relatively unique way. It takes various forms. And so just want to spend a minute talking about some of the ways that it manifests itself. When a county starts to build or design and install an integrated system, some or all of these various components are important, some more important than others. Some are historically rooted. We have, for instance, been cooperating across systems for a long time. We might call that functional integration. We have had a fair amount since the KDA settlement of some collaboration, which is, one example is a physical co-location. And it's a critical component of systems of care because it helps to close the gaps between systems. When we move to what we might characterize as more a fuller or a larger system integration, that's where we get to some complexity, and we have to challenge ourselves to figure out how to share the resources, the information, and the organizational structures, and that would be characterized here in the fiscal and organizational integration. Much more complex, much more challenging, but that's where the payoff comes in terms of a return on investment and the effectiveness for kids and families. So it's one thing to cooperate and collaborate. It's another thing to actually behave as though you were part of a large organized delivery system. So deep within Assembly Bill 2083, and I say that somewhat facetiously, it's not a complex piece of legislation. It's really quite simple. It does require certain elements, and so some of the highlights here are county systems, local systems, including regional centers, have to execute a memorandum of understanding between these providers, and we'll talk about them in more detail in just a moment. Likewise, there is state guidance that's required, and we'll talk about that as well. We've begun to deliver some of that. There will be a process shortly, assuming we can work our way through the pandemic response that's currently challenging us. We will get to a place where we'll have some technical assistance delivery going on from the state to local systems. At the state level, we're in the process of identifying gaps in placements, and we'll make a report to the legislature in January of 2020, along with a multi-year plan to deepen and sustain the work. So there's a relative thoughtfulness to Assembly Bill 2083, and we should celebrate the California Welfare Directors Association for offering the legislation back in 2018, so good for them. Two quick quotes from that, and I'll just let you ponder on these without me verbalizing over, but you can see the intent of 2083 is captured here. Required by Assembly Bill 2083 is a membership of 5 parties. These are the absolutely minimum partners, and the ones I would actually recommend starting with. We have other collaborative partners that can and probably will be in some jurisdictions part of their formal memorandum process and part of the interagency leadership that comprises a good system of care. I will say that as you're helping to support and guide the installation of system of care, the more partners at the table during the formation, the more complex it is. And so it can be effective to remind ourselves that as we're learning to walk in a large system of care, we should keep it simple. Other partners can be added in different ways, some informally in the beginning and then more formally later. But the more partners that have to sign off on that MOU, the more difficult it will be to actually anchor the agreement and the alignment that's necessary to do system of care. So in this top quadrant, the 5 required parties, and in the second compartment, you'll see others who are critical partners, but not required by the law. This slide highlights the required components of a memorandum of understanding. So as county systems, sorry, I keep using the word county, but I realized when I do so, I'm leaving out regional centers, right? So I'm trying to discipline myself to speak in terms of a local partnership, which for me captures both the county departments and the regional center and other partners that may be uniquely present for systems across the state. As they get to a place of conversing and planning how to do system of care, and eventually to do FFPSA and other initiatives within that system, there are 11 components that are pretty much required. And there'll be some oversight to this on the part of the state. I will say, I don't anticipate that this will be a hard and fast per se as a county system and their partners submit an MOU, but these are the 11 components. It starts, of course, with interagency leadership. If there isn't an alignment and a process to support conversation around planning, data review, how we're going to do the rest of it, the other 10 elements won't be possible without interagency leadership kind of leading that effort, obviously. Some of these components you'll see are already in existence. County systems have had to practice interagency placement committee process for a long time here in California. You'll see child and family teaming and unified service planning, which has been part of CCR, and other various components. The deeper you get into these, the more kind of systemically rooted they are. But again, that's where the investment will pay off for itself in terms of having a singular, unified, connected system. That's where the cost savings really comes, because you can start to identify redundancies in organizational systems that can be mitigated and reinvested in upstream. But those are the 11 components to a local memoranda that's required. There is some guidance available that will come to local jurisdictions in a number of ways. And again, that webpage that we highlighted earlier has links to that document. We're calling it a toolkit. I will say that much of the detail is not yet public facing. It's being developed. You'll also see in the next couple of weeks, hopefully, the first invitation on local systems to join a monthly technical assistance webinar. The first one is scheduled for May 6th at 10 a.m. Some of you may be familiar with the KDA's Pathways to Wellbeing webinars, those technical assistance calls that the state has been hosting for a number of years. Before they were KDA technical assistance calls. They were wraparound technical assistance calls for you old timers, gray beards like me. So we're taking that process and just enhancing it and developing it into a system of care technical assistance call. So the first Wednesday of each month, guidance will be available to local jurisdictions to help not just craft an MOU again, but to align their systems and bring them into synchrony so that they are fully connected. Lots of resources here highlighted for you, not just the state system of care webpage, but various profile links so that you can kind of see the partnership that's required. You can find links here to the actual legislation, the assembly bill that was passed into law a couple of years ago now, and then the guidance documents that are coming. So that's a quick look at 2083, and I know we've got questions coming at the end. So I'm going to stop my sharing and turn it back to Amy.
Great, thank you. And let's see. Well, did we have some additional polling here? Lost track of my slides here. Let's see, get back here. Okay, so 2083, we're going to kind of switch gears a little bit and start talking about families first and the readiness assessment specifically that Chapin Hall developed. We have a couple questions that we put up in polling. If you guys can just take a second to answer that. For those who attended the convening that we held on Families First back in November, we talked a little bit about this readiness assessment. We knew it was coming. Chapin Hall was just making some final adjustments, so we didn't have copies of it, but they have since used this in a couple other jurisdictions and put together some really nice accompanying documents along with the tools. So I'd like to take a second, kind of go walk through all of that. I wasn't going to screen share the tools, but I think I am going to do that just for so folks can really get a chance to kind of look at them. Looks like the polls are coming in, so we're about 69% have developed a steering committee for implementation. That's great. And then same thing, around 69% are starting to include the system of care partners in the planning. That's awesome. Great. All right, so let me back out of this for a second, and then I can kind of show you the documents. All right, well, let me see. Okay, so so Chapin Hall has the actual tools themselves, and then they have two briefs that they have that come with it. The first one is a facilitator's guide that actually walks you through the tool, how to use the tool, you know, who to use it with. And then they also have a components brief that walks you through each component and then a description of what each of those components are, as well as some really good questions to ask. So let me jump over to the tool itself, and you guys can take a look at that. So give me one quick second. Share. Okay, so this is the actual copy of the tool. So you can see, like, on the first page is the assessment tool. It asks some starts off with some overarching questions around just sort of the assessment, planning, and implementation questions. So the first one is around kind of like, what is the transformative vision of Families First? What's sort of the sequencing, and what are some of the interdependencies that you need to be thinking about? What are some unique jurisdictional factors? And then it actually starts to walk you through each of the components, and there are 18 different components. So target population, shareholder engagement, communication, practice model, child and family teaming assessment, case and service planning, service array, casework and supervisory practices, policies, regulations, rules, workforce capacity and alignment, training and coaching, data analysis and evaluation, continuous quality improvement, data collection, federal reporting, information systems, contracting, budgeting and appropriation requests, and then the last two was around federal plans and reporting area, accountability, claiming, and systems component area. So those are the 18. And then once you, I'm gonna move people over here. Once you have the assessment tool, there actually is the provision planning tool where you would kind of carry over all of your action steps, assign kind of a start date, target date, and your notes. So what's really nice about this is that, current slide. What's really nice is that it's sort of all there. I think folks who are familiar with the NURN's implementation installation checklist, like it reminded me a lot of that. So it's pretty obvious to, when you're looking through it, like it makes a lot of sense. It kind of matches really good implementation, but it really aligns with the components of the of Families First. Okay.
Excuse me, Amy, we have a question. Oh, it looks like it's already been answered. Wanted to know who had developed the assessment tool, and looks like that was Chapin Hall.
That was Chapin Hall, that's right. So Chapin Hall did this, and we'll kind of talk a little bit around their end in terms of their availability for additional support. But again, this tool is at the Academy website. I have this link down here, and we'll email it to everybody so you can walk through this tool yourself. But I think thinking when you looked at that tool and, you know, understanding kind of what 2083 and the MOU, you could really start to kind of see and align kind of the areas around, you know, where some of the questions that were being asked and how that really fit with what the MOU was really requesting of the interagency leadership team around thinking about and planning for and supporting kind of the systems of care. So Richard and I kind of attempted a little crosswalk at this, and so this is kind of an example of this. So for instance, the transformative vision, it asks about like, what is that vision? What is the sequencing and interdependencies? What are those unique jurisdictional factors? Like all of that, right, would come up in the MOU and thinking about for 2083, like who is on that leadership team, who needs to be a part of this, who can answer these questions, who can drive this vision forward. Who can be thinking about those unique factors that we need to be accounting for when it comes to Families First. So the first component is target population. What are the service needs in the target population? Again, that's also in the MOU, so that's in part 7 in terms of the alignment and coordination of services. The service needs, it falls within the screening, assessment, and entry. So practice model component. Sorry, Val, did we have a question?
Excuse me. Yeah, we have another question asking, is the readiness assessment a one-time activity, or will it be repeated throughout the process to assess readiness?
Yeah, so I think I think it's an ongoing document, right? There's no way, because sort of the same thing with like an installation checklist. Like the idea is that the assessment is like, where are we right now? And then what are those things that we need to start doing in order to plan for this? And what do we need to move over into our planning? But you're always going to go back and kind of reassess where you're at and go, okay, wait, we've done this. Now we need to kind of be looking at some of these other components. It's the same thing like when you're thinking about like the science of implementation. It's really hard to be looking at every single step within implementation all at the same time. And so there does have to be some sequencing, some things that have to go first before you start to look at it again. But the important thing is that you are going back and doing that reassessment over time. So it is an ongoing process. So good question. All right, so practice model component area of Families First. You know, we do have an ICPM here in the state, which is great. So and it's also in the MOU around how does this core practice model, how does this support the work that we want to do here locally? How can this support that we want to do in terms of Family First? Child and family assessment component area. So this asks about like, what are the extent of the current agency assessment tools? Are they sufficient to implement the plan? Do we need to have new tools? What extent are the assessment process or timeframes, related practice sufficient to implement the provisions? What extent do we need to strengthen the quality of our assessments and use information to guide the service planning? Again, that is also part of part 4 of the MOU, so screening, assessment, and entry into care.
Okay, Amy, and then Judy Weber has another question. How do we know what's needed? Is there pre-work for engaging the community? So if you could answer that, that'd be great.
Wow, that's a really good question. So I think, for the purposes of this webinar, the idea was to really be thinking about like, all right, like, the MOU is that really good foundation. It's that's sort of the beginning stages of how do we look at kind of all of our systems reform work. Families first is sort of coming up. So yes, thinking about families first, but, like really all of our efforts. So I think going back to the comments that Richard talked about in terms of like for the MOU's purposes around, maybe keeping that interagency leadership smaller, and then sort of having kind of those subgroups that you then use to help support kind of that stakeholder engagement. I think about, so Judy, you asked a question. I'm thinking about in Ventura, you have, when we started the SOP implementation, right? You had folks who were leading implementation within the agency, but then you had some subgroups who were working specifically on communication plans with stakeholders within the community. So I think the idea is that that group is sort of identifying like who are the folks that we need to be communicating to, and then making a plan to involve them when that time is appropriate, when it makes sense, but then going back and asking that question, is there anybody else that we missed? Do we need to add more folks? Do we need to think about engaging other folks? Does that answer your question? Can you see that, Val? Richard, did you have anything you wanted to add?
I think it answered the question.
Okay, Richard, did you have anything else you wanted to add on that?
No, I think that's a good answer, Amy. And I suspect there'll be 58 answers, Judy, that the needs will come from the local conversation. And not to make it more complex, but, and Judy knows this as well as anyone else, in the county, at the county level, there are other implementation plans or other needs assessment plans going on around child and family teaming, CANS implementation, et cetera. So in some ways, you could, hypothetically, if I were back in a county, I would look for ways to take this needs assessment and align it, eliminate any redundancies, and coalesce it around other implementation plans that are already underway.
Yeah. Great, thanks, Richard. All right, so number 18, the accounting and claiming area and systems component area. This is also part of the MOU with around sort of financial resource management. So thinking about like, how do we make modifications? How are we, braiding funding? How are we making modifications to, our current systems as needed? With Families First, I know we've talked about this a lot at the last convening, is that, it really is a funding mechanism for us to think about the work that we want to do differently. So we've said for a long time, like we want to do prevention differently, but we don't have, the dollars don't follow it, right? So it doesn't make sense. We haven't been able to do that. But if you really start looking at, what 2083 is asking us to do, it really does set up that work then to make the most use of the funding, either through our current systems, through the state, and then also now through Families First, to really do those things that I think that we wanted to do for a really long time, but didn't necessarily have the funding mechanisms to do that. But I really, that point around, making sure that we are thinking about that in our transformative vision, and as we're developing that MOU, really is super important, because if you get too far out in Families First, but then you have to go back because your MOU didn't account for all of those things that you wanted to do, you may not be able to make the most of the flexible funding that is now being offered to you through Families First. Okay, so why does connecting the two matter? I think we've kind of made a couple of points, but we have some additional slides to kind of help folks sort of see the connections between Families First and AB 2083.
So Amy, I was just going to ask, are you going to switch back to your slides now?
Oh, sorry.
We've been on your Excel sheet for a bit.
Okay, let's see. I think I have to stop sharing and then reshare. Okay. So Richard, so if Families First and Systems Care are done well together.
Yeah, thanks, Amy. And I just love the vision of Chapin Hall in providing a formulary, a template that will potentially help guide this work. I think if a local partnership is successful at anchoring its FFPSA planning and installation into a system of care, what you're going to get are outcomes similar to good system of care outcomes in any jurisdiction, which includes these things. So our school attendance rates will increase. Our school outcomes will be better. Kids that go to school graduate, and kids that graduate are much more likely to be independent young adults. We'll get decreased behavioral and emotional issues, less suicide, less substance abuse, less corrections involvement, obviously. There's a fair amount of research that says good system of care work, particularly when we get upstream with that system of care work, we reduce the caregiver strain. And of course, we expand our capacities as systems when we're sharing revenues and resources. So that's just a quick look at some of the ROI, if you will, of good integrative planning. Yeah, this is just a continuation of that work. So other outcomes that are pretty well established in the SAMHSA research. Some of these are kind of eye-popping, but they go back 30, 35 years. The work of Sheila Pyers and Gary Blau and others at SAMHSA or at the University of Maryland or Georgetown Technical Assistance Centers establish these kinds of outcomes. So system of care pays off, and FFPSA is a wonderful way to further anchor it or drive it upstream, if you will. I think just by way of kind of summary thoughts, as you're pondering on how to move a local conversation planning into system of care, remembering that keeping kids in community really does take partnership way beyond social services. Social services is one portal, and it's a portal that's pretty downstream when it comes to child protective service and child welfare. So our social service partners have other tools, and other systems outside of social services and human services have other tools. And if we're going to be effective, we got to get them way upstream. One of the ways that you might think about it, if you're in a local jurisdiction, you have to go to your board of supervisors or your county executive office in support if you're looking for dollars, or to preserve dollars that are going to be precious in the next couple of budget cycles at least. Some of the message points around return of investment that we just highlighted in the two prior slides, those could be critical. That if you can document the kind of cost avoidance that comes with good system work, you'll get a lot easier buy-in from your board of soups and your CIO's office around giving you the flexibility to do that. Yeah, and then finally, building good systems work, whether it's FFPSA driven or not, really takes some heavy work. I mean, it's a heavy lift, and it's important to keep reminding ourselves that other forms of working together are not the same as integration. If they were, we'd have whole systems in California already, because we've been cooperating and collaborating for a long time. It's not the same as integrating. And so while it's hard and heavy work, we got to get there. It takes courageous managers and leaders to challenge their own sets of beliefs about ownership and power and authority and all those things that kind of keep us separate. It requires a fair amount of cross-training, which is why this conversation is important. We have to begin to explore and push the envelope, if you will, of shared understanding about what other systems do and how we can support one another, right down into the teaming environment. So it's not just about administrative process. It's not just about the organizational connectivity. It's about a social worker and a behavioral health clinician, or a social worker and a school counselor, understanding each other's systems and finding the places where they can connect. Finally, just a recollection or reflection that families heal in relationships. And I'm concerned, particularly in the pandemic response environment, that our systems will flee the sandbox, if you will, we're going to have to invest in senior leadership being as trust-based and relationally based as we possibly can be, if we're going to not just do good planning and implementation on system of care, but if we're going to do it in what will be an environment of scarcity, of economic scarcity, probably in the next few years. Finally, there are some other system reform efforts that you can, I think, remind folks about when you start to have these conversations. FFPSA is just one place where system of care provides a vehicle or a container for good design and implementation work. The CalAIM work, although it's likely to experience some delays given the situation we're in now, is another place where we need to anchor CalAIM in system of care. Schools are doing multi-tiered systems work and PBIS work, positive behavior interventions and supports on school campuses almost statewide. And in order to implement that effectively, along with other education reforms, a system of care is a great conduit for that. The ideas, the concepts, the principles and practices are so similar that there's no reason we shouldn't be connecting the MTSS work with system of care work. Of course, trauma-informed work, particularly for a juvenile justice cohort of kids, is best anchored in system of care. And finally, the ACEs work and building on strengths of kids and families and communities to mitigate adverse childhood experiences is best done in a system environment where those strengths can be called out in teaming and where we can keep good track of data and roll those strengths up and recognize where communities as an aggregate need supports and where they don't. And we can put our resources where they're best used in support of a really effective trauma-informed place.
So as Richard kind of said earlier, like this is not easy stuff. This is pretty challenging. And so, we do know that there probably will be some kind of level of technical assistance that, counties will need to kind of engage in. And I kind of was sort of thinking about this, and thinking about like the tale of two counties, right? So you have County A, which has, a few smart folks in the room and they know how to put together an MOU. But what we sometimes see is that, they really lack the authority or leadership to be able to drive that larger service provision forward. And so they, could end up keeping that MOU very narrowly focused, right? But they're able to at least, get the MOU done, right? But then there's sort of County B, right? So County B can maybe takes kind of the long-term approach. It recognizes it's going to take a little bit longer, and they have those same very smart, very capable folks in that room, but they also have the authority, they have leadership who have the authority and the vision to really be thinking about that MOU that doesn't just serve that narrowly focused group of kids, but really thinks about all of the children in terms of the who come into our system. And we recognize that this is going to take probably a lot longer, certainly longer than the, I think, initial date of June 2020 for this MOU to be completed. But it will require a lot of adaptive leadership skills to really be thinking about how to kind of wrestle through system barriers. And again, recognizing that, probably will need some outside technical assistance. Okay. So in terms of the technical assistance that are available, so we went through the Chapin Hall tools. They've provided it so folks can use it, be able to kind of take it off the shelf, but they also are available for technical assistance in person. So you could reach out to them. Casey Family Programs is doing quite a bit of work around supporting families first within the county. They're available. The regional county academies throughout the state are, supporting counties kind of as needed basis. So like this webinar, through convening, through regular conversations. Richard and his team, the Systems of Care Technical Assistance team, is available to support certainly the building of the MOU. And then, there are also local resources that we know that all of our counties here in Southern tend to, can and tend to engage in. So I'm curious for folks, what kind of strategies or assistance are you currently using or thinking of using to support your county efforts? as it relates to 2083 and Families First. So feel free to go ahead and unmute yourself and, kind of sort of share what some of your counties are doing, or you can do it through the chat room, that's fine. And then, I wanted to open it up just for general questions, either for Richard or myself, or for all the counties to kind of just sort of chat and collaborate together.
Okay, Amy, and we do have one question for you from, again, this is from Judy Weber, and it's probably for you and Richard. Can you talk more about what a pathway for all children would look like? And the second question, is this PowerPoint going to be sent out? And the answer to that is yes.
Richard, did you want to take the pathway?
Judy, you always ask the best questions. The two reflections I guess I'd have by way of example. When I think about system of care applying to all kids, so broad reach or full system implementation, the prevention work group that you are doing in Ventura and that probably 30 other counties are doing, bringing together cross-system prevention leaders in a local community to talk about how you're going to get to kids kind of before they enter one of the deep end systems. If I were thinking about a pathway, a system of care pathway, I would be bringing that conversation into my interagency leadership team under the MOU in a pretty consistent way. Hypothetically, every 90 days, I would invite my prevention coordinators to come and make a presentation to my interagency leadership team and say, hey, what are we doing prevention-wise to not just implement FFPSA, but all the other prevention efforts that we have, all the other resources that come to all of our departments to do preventive, early interventive work. How are we aligning them in such a way that we keep kids out of welfare, we keep kids out of hospitals, we keep kids out of STRTPs, we keep kids in state, in community. So that's one example of I think what a pathway for all kids would look like. And the other that I think the most common example I see is the Mental Health Services Act, where Department of Mental Health folks around the state at the county level have often effectively used their prevention early intervention resources, the PEI allocation under MHSA, to reach kids who are maybe even unidentified yet, but who are at risk of entry to a system. Mm-hmm. And if those PEI services are coordinated, if they're well planned for and well executed, we're keeping kids out of welfare and probation and deep end services in mental health, and potentially even deep end preventive developmental services. I guess I don't know that I know any personal examples of that, but I guess it's possible. So those are my two quick reflections on what I think the intentionality is around a pathway for all kids in system of care, if that's helpful.
Yeah, the only other thing that I would add is that I felt like, and I don't have it at my fingertips, but in the Families First plan that DC submitted, it was really clear where you could sort of see where, they had some initial programming around reaching those sort of at-risk, families, right? Not just children, but at-risk families, and how they were using the Families First, or the changes to Families First, and the using of those dollars to kind of move everything up in the sort of chain in order to support families, so that hopefully we were reducing the overall number of youth coming into the system, but then if they were coming into the system, that there were plans in place to support them very early, so that you didn't see that sort of increase in higher needs. So kids needing hospitalizations, or kids even needing, foster care provision, either in juvenile justice or in child welfare. So I think that's really the opportunity that Families First provides. And I think going back to also that comment that Richard talked about is that the fear is in this crisis, and we know sort of like, there are going to be some, significant crunches to people's budgets. Like, this would be even more of that opportunity to sort of make use of, how the dollars could help, support the overall goals, not just of the state, but also of the local jurisdictions.
Okay, Amy, and we have another question from Carolina Navarro Gomez, and she's asking, how could I integrate the information from today's webinar during a training with line staff? So in other words, how can I inform on a micro level, if that makes sense? Thanks.
Yeah, that's a really great question. So thanks, Carolina. I mean, I think really challenging, even in line, right? Even in core, really challenging staff to be thinking about not just like what are their requirements, under child welfare in order to serve this child, but like where are they connecting with their systems partners? How are they using teaming with their system partners, as well as family and sort of local groups, and sort of bringing kind of that macro connection is that, look, for a long time, the way that the sort of bureaucracies were set up and the way the funding was sort of set up, it didn't allow for a lot of teaming kind of at that higher level. And so that there are changes now being made at that higher level to sort of facilitate those conversations happening kind of at the micro level. But I would say that even though there were challenges at that macro level, there are lots of examples of, of child welfare social workers or wraparound folks in departments of mental health, or even within, juvenile justice, of them sort of like reaching out and really doing sort of that teaming at that basic level to go, okay, you know what, maybe the system piece isn't perfect, but what is it that we can do for this child? And so really asking those questions about like, okay, we know this stuff is going to come and it's going to help support, but what is my responsibility as a child welfare worker to ensure that we are doing the best in terms of, looking at the system to support this child, support this family. Is there anything else that you wanted to add, Richard?
Just the place where, so I think I agree with everything you said, and the place where I think that is most evidentially anchored is integrated core practice model training. So this is why you've heard me and other people talk about bringing welfare, probation, behavioral health, education into a shared learning environment to do ICPM training, because that's where you get a uniform teaming, uniform engagement, uniform transition, uniform service planning conversation across the spectrum. So that's where line staff have to get that interconnectivity, if you will.
Yeah, great point. So we have a few minutes left. I'm curious, was there any other counties are here from Ventura? We had some other questions from LA. Any other questions from counties out there, either of other counties on the call or of Richard or ourselves? And feel free to unmute yourself. You can unmute yourself now on the call.
Hi, it's Judy. I got here late, but wow, there were some really good nuggets from what I heard. I'm looking forward to getting the PowerPoint and those tools.
Yeah, Judy, we're going to send the PowerPoint, and then we have everything listed up on our website so you can have access to that. So we'll send that out to everybody afterwards.
Okay, thanks.
Right. Glad that it was helpful. Anything else before we end the call today? Well, I would just like to say again, thank you all for participating and for coming on today. We hope that this was helpful and that this was informative. I'm looking forward to continuing these conversations. Hopefully the next time we do this, we can actually do it in person, fingers crossed. And then thank you again, Richard, for, I reached out, I was like, Richard, can you help me? And he said, yeah, absolutely. Let's see what we can do. So thank you very much, Richard, for making yourself available. And I wish everybody the best.
Thanks, guys.
All right. Thank you.
Take care.